Come in. Okay.
Okay. Good afternoon, everybody. Good morning. Here from San Francisco. This is Mike Reed. Just checking, can people hear me okay? If so, then just respond via the chat messaging system if you're able to hear loud and clear. If not, we can address that. Sounds like there are some audio issues from some of you. So are people able to hear? Just let me know in the chat box if you're able to hear okay. Great. Sounds like some of you are hearing loud and clear, which is the goal. So thank you all for joining. I took the liberty of putting everybody on mute. That is not because I don't want to hear all of your voices, but with so many people on the line and to minimize sort of audio disturbance, you are all automatically muted. If you have a question, then the best way to ask it is either via the chat box or let me know and I can unmute you. As I say, this is primarily to improve the audio experience for everybody rather than to prevent you from contributing. So thank you all for being online right now. So let me begin by welcoming you. As I said before, the sun has just risen here in San Francisco, and it is a beautiful summer's day, not a cloud in the sky. But as you guys, many of you are finishing the end of your workday, we are just beginning here. And it is a real privilege to be talking with you this morning. I'm going to take myself off video and continue with just the screen for the time being. So this is the first of 10 webinars that we'll be doing over the next 2.5 months with a goal to, as rapidly as possible, bring you up to speed with each of the modules that have been developed. And give you the opportunity to interact with the content, hear from the experts who developed them, what the overarching goals of the modules are, as well as to ask a few questions. Our hope is that these webinars will serve to equip some of your master trainers to bring the program leads, principal investigators up to speed with each of the module content if you're not already up to speed, and then allow you to be the key disseminators of this resource to those individuals that will be doing training of training and then training your learners. Let me begin with just a few formalities in terms of webinar etiquette. As I said at the top of the hour, I put you all on mute, and the goal will be moving forward over the next 10 weeks to have each of you to start each webinar 5 minutes after the allocated time. So we'll start at 3:35 Central African time, and we'll try and finish 5 minutes before. If you have questions, please write them in the chat box. And as I allude to on this first slide, all the webinar content will be recorded and posted to the AfriHealth website in the first instance. And then once we have the Stripe website up and running, they'll be located there. The Stripe website, for those of you that weren't in Lagos, will be linked to the AfriHealth website. So you can locate it by going to the AfriHealth website and then finding the content there. Any questions, you can always email me, michael.reed2@UCSF. And in addition, if there are colleagues from your institution that you would like to be receiving the invite to this webinar who aren't currently receiving the invite, please email me and I can add them to the eVite list. So without further ado, let me jump into the roadmap for today's webinar. I am going to spend just 5 minutes giving you a brief overview of the approach to the modules in terms of format and structure, and then speak specifically to the interprofessional element of this. And each webinar over the next 10 weeks will also address some piece of learning methodology that will be important for your trainers and your master trainers to understand and be able to embed into their educational practice. So we want to give you a few sort of teaching vignettes along the way. And then we're very fortunate to have Musapeli and Clara to give us an overview of the 2 modules that they were involved with. And we'll spend a few moments, probably about 15, 20 minutes on each of those modules with a goal to ending the call at 4:25. As always, if there are questions, you can add them in the chat box. So let me begin by talking about the Stripe approach to learning and sort of how we envisage these modules being used. As everybody that was in Lagos will know, this is a tremendously exciting opportunity with funding from the US government to support a new endeavor which enhances interprofessional education whilst enabling your learners at your institutions to become, better rooted in the fundamentals of HIV service delivery and equipped with new tools, or better able to use tools that they're already aware of around quality improvement. The overarching vision for how these modules are used is an interprofessional framework. And so what does that mean in practice? Well, our vision is that these modules will be taught in an interprofessional context. So you will bring together learners from different professional cadres, pharmacy students, nursing students, medical students, laboratory scientists, even some of the allied health professionals, depending on who gets trained at your institutions, and as well as those individuals that are at the outset of their professional career. So newly qualified nurses, pre-registered medical house officers, newly qualified pharmacists, etc. With a goal to bringing those learners together in a context where they are also where they are able to learn together. So our hope is that there will be 3 dimensions of interprofessional education that happen as we bring trainees together. So the learning environment, by bringing these diverse cadres together, they will learn together. The expert trainers, our hope is, will reflect that diversity of professional experience. So our hope is that you will recruit not just physicians and nurses, but maybe pharmacists and other allied health professionals to become master trainers. I think I forgot to mention the importance of clinical officers or clinical associates, and other mid-range providers. These are also an essential cadre, and we would hope that they would be included in your training. So we bring together learners from diverse settings, and they're overseen by trainers from diverse professional cadres. And then the content itself should also help them to establish greater competency so that they are able to work with individuals from other professions to maintain a climate of mutual respect and shared values. This is the values and ethics issue that we hope that they will gain competency in. It is also our goal that these modules enable learners to use the knowledge of their own role and those of other health professionals to appropriately assess and address the healthcare needs of patients. So we don't expect a nursing student to learn all of the responsibilities of a medical student, for example, but really appreciate what is their responsibility within the team-based approach to care. Another key element to this is helping the learners to be more effective at communicating with patients, with families, with communities and other health professions in order that they are responsive and responsible in delivering a team-based approach to promoting and maintaining health. And finally, a key ethos of this training approach is that it fosters better teamwork. And so our hope is that by learning in this format, they will be able to apply relationship building values and the principles of team dynamic to perform effectively in team roles to deliver better patient-centered care. So that's sort of the overarching vision for this. And to clarify, our hope is that not only are the trainees from diverse backgrounds, professional cadres rather, but also that the trainers. And so certainly one thing that we would hope is that the training of trainers can involve, professionals from different cadres. So bringing together nurse educators, physician educators, overseeing clinicians at the distributive training sites that come from different professional backgrounds, and thus sort of foster interprofessional collaboration at every level of the training approach. The other thing I would just like to say here is really a specific. I'll draw your attention to the specific way that we think that this will be delivered, and appreciating that it will be delivered differently in different settings. But our vision is that the modules will be taught in such a way that there'll be 4 to 8 trainees sat around either a table or a desk or in a group of chairs from different professional cadres, and they will work through the content in each module with a trainer or facilitator who will probably be walking amongst different groups. So we don't envisage that there'll be one facilitator for every 4 to 8 learners, but rather that there'll be one facilitator for 4 groups of 4 to 8 learners. And that way, each trainer or facilitator will be able to cover a larger audience of learners. Obviously, we recognize that things are going to be different in different situations, but that's the overarching goal in terms of format. And then just to reiterate a point that was made again in Lagos, our vision is that ultimately these trainings are delivered at the peripheral sites, often those sites with the highest HIV burden, as well as or in priority over the tertiary referral centers where each of you or many of you are primarily. That these webinars and the modules that we're going through now will enable you to ensure that they're able to get up to speed with the content. So having introduced this, what I'm hoping now is that we can review 2 of the modules, and I'm very grateful for my colleague Masipeli from University of Botswana, who led on the second module, which is on managing patients with comorbidities and well-controlled HIV. So Masipeli, just quickly a sound check. Are you able to speak, and can we hear you? Are you there, Masipeli?
Muted. I can.
Okay.
Are you? I've been
no, that's good. Apologies. Apologies. Okay. Now I think we can hear you now, Masipeli. So over to you. Do you want to give us an overview of this module, and then I can ask you a few questions, or you can run through the questions that we talked about before the call?
Cool. I'm happy to do that, Mac. Are you controlling the slides on your end?
Yes, I will do. You just give me a nudge.
Cool. No worries. So basically, the overview with this particular module was to actually introduce the idea that people living with HIV are at a significantly increased risk for cardiovascular diseases. And we would love for trainees at the end of the completion of the module to have identified common risk factors and be very competent at primary prevention for cardiovascular disease among folks who are living with HIV. As you can see on the right side, I have a list of objectives there, identifying cardiovascular risk factors, and then recognizing that it's very important to put together these risk factors to get a sense of the level of risk that the patient is at, and then to discuss recommendations that should be followed, typically lifestyle changes first. And then number 4, if they do choose to use pharmacologic therapy to reduce the risk for cardiovascular disease, to also be mindful of the drug-drug interactions when using commonly used agents for lowering cholesterol. And the theme throughout the whole case will be that different team members will place leading roles depending on their specialty and the problem at hand. I don't know what happened with the last one, Mike. I think it got cut off, number 6. I recognize the negative impact of something. Hello? Can you hear me?
Yeah, I can hear you. I can pull that up and correct it for you, but offhand, luckily I don't have it at my hand. Yeah.
I suspect it's one of the objectives that you added. Remember our email conversation?
Yeah, that's right.
I think. So the next one.
It's off here. It just says recognize the negative impact of cardiovascular disease on long-term outcomes of people living with HIV.
Right.
Perfect.
Right.
Thanks, Hoffman. I remember now. On this, actually, it's number 6 on this next slide. So basically, going back to objective 1, this is going to be a small group discussion in terms of exploring the risk factors in the case. This is almost like your sort of case-based sequential disclosure model, where we disclose bits and pieces of information for the trainees to identify the risk factors before moving on to the next section. That will be evaluated with some multiple choice questions, and there will be a Likert scale looking at how comfortable they are in identifying cardiovascular risk factors in the context of HIV. And then objective number 2, the main aim here, as I said earlier, is to help the trainees think through the importance of putting together multiple cardiovascular risk factors to begin to predict risk of disease. And here they'll be using the WHO tables to do that. And again, this will be tested in a similar fashion, evaluated as objective 1. Number 3 is very important in this context because we really want the trainees to be able to identify things, particularly around lifestyle modification to mitigate against development of cardiovascular disease. And again, this will be a small group activity, and hoping that everyone will be able, from their own standpoint, whether it's a diet, physical activity, weigh in on how they would help reduce the risk of cardiovascular disease. Number 4, I guess, again, managing drug-drug interactions, because there's a few that occur in the setting of a prescription of statin therapy, that hopefully the pharmacy and the medicine colleagues in the group will walk the rest of the team through some of those drug-drug interactions for the benefit of the patient. And again, this will be assessed using multiple choice questions. Number 5, in this particular module, what happens is number 1 to 4, those objectives will be addressed using a case, a scenario of a middle-aged man who is at risk but has not yet experienced any cardiovascular endpoint. And then number 5, they will then be given a new case in which they have a young lady with established stroke. And then the question here would be, how can they together identify ways to manage someone who has established cardiovascular disease, really optimal secondary prevention in someone with cardiovascular disease. And again, they will do this together in a group. And then number 6, really is looking at, from the patient perspective and family perspective, what are some of the long-term outcomes? So again, they will use both case 1 and 2. Case 1 looking at how maybe erectile dysfunction in someone who's at elevated cardiovascular risk, and then has issues with his partner in terms of lack of inability to have sexual intercourse. And then they will then turn to the second case, which again is a young lady with with established stroke, and then they will look at the impact of disability following a stroke, and including basic things such as quality of life and bed sores and the like from the different areas of practice. We can do the next slide, Mike. Thank you. And what are the learning methods that we employ here? Not an expert, and so I'm hoping you can all help me. Case-based, I think, is really the primary. Like I said, is more of a sequential disclosure case, where I'm hoping that at every stage they will be given a little bit of information, interrogated, and then they'll be given additional information and keep on developing or predicting what new information they need to have had in order to move on to the next stage. I think when you look at the case, you will see that there will be, even in certain instances, be given like a little table to say, can you list things that you need to think through as you think through cardiovascular disease before the answer is revealed to them.
Mr. Pelly, Mike here, quick question for you. So we include here these clinical prediction tools. Yes. For those on the call that aren't familiar with those, could you just quickly speak to them and how they'll be used in this module?
Definitely. The importance for including risk prediction rules is to sensitize healthcare providers to the challenge of doing primary cardiovascular disease prevention, in that most people who are at risk will only be identified if one can put together multiple risk factors and using some algorithm that's been validated out there to then say someone is at high risk. The challenge with this thing is in most instances, people only access preventive therapies as a secondary prevention. And if anything, if there's anything that I would hope trainees will get out of this module, is to appreciate that the approach and the most effective approach for preventing cardiovascular disease is to bring together multiple risk factors and then start to predict who is at high risk and then manage them accordingly. And that looking at things in isolation does not actually lead to comprehensive cardiovascular risk prevention. The WHO a guideline which is attached as one of the resources, but they will be given the tables that they have to use. And basically what these tables will make them do is, say patient X with this cholesterol, who's a smoker or not a smoker of gender XY and this age group, and then just follow the table and say, with someone with those risk factors, where are they? Are they in the green or the orange or the red? And therefore, whether there is an indication for them to start primary prevention. I think I only left it at the WHO guidelines. There are other risk calculators that we could use, but I thought the WHO ones were probably the easiest to use in our setting.
That's great. And then I think the second question, what is the core content that we're trying to communicate? I think you've answered that really clearly, Mr. Pelly. Maybe you can speak to the question about interprofessional educational tools. What are the essential tools that we're trying to deploy here or teach the learners to use?
And again, the way the cases were developed was to actually force teamwork and collaboration and leadership on different issues at different times, so that we really foster teamwork or interprofessional education. For instance, in this particular case, when it comes down to what additional tests should we order, the lab, lab scientists or technician in the team will have an opportunity to say what is available in that setting in order to assess for diabetes and or high cholesterol. Again, the same thing would apply in terms of, I think, objective 4, where the pharmacist will take the lead in sort of trying to describe what the drug-drug interactions that are important to consider would be. In case 2, for instance, the well-being of the patient and monitoring for bed sores and the like after stroke will be an opportunity for the nurse in the group to lead in terms of how do you then, provide comprehensive care that is not, just medical, but more nursing, from a nursing perspective. I don't know if I answered that correctly, but I'm happy to be guided.
No, I think that's right. I think our goal with the case is that we, learners learn from the other cadres how they would manage, these different risk factors. And specifically, they understand the importance of role clarification. And then clearly, the last piece is that it emphasizes the importance of a team-based approach to managing these patients with complicated comorbidities. So I think you summarized that nicely. Thank you, Mr. Pelli. The last question here, Mr. Pelli, are there QI methods or domains in this module? Let me answer it for you, because there aren't. As many of you will know, we've tried to weave QI into many of the modules, but this is one where we haven't included a specific quality improvement component. But I think what we are encouraging the learners to do is critically evaluate the available patient-level data that they have, so that they're able to understand the patient's needs and within a broader context, understand their relative risk factors for diseases. And so in that sense, that feeds into a quality improvement agenda. Does that sound reasonable, Mr. Pelli?
Yes, I was actually going to ask you to help me with this one, because I didn't think we had a great QI piece that was distinctly sort of, separate from whatever else is in the case. So, but thanks.
Yeah, that's great. So thank you, Mr. Pelli. Maybe if there are specific questions about this case, we can take a couple now. So if you have them, add them in the chat box now, and we'll try and answer them. There is one here from user. What if we could have a scenario with components to lead the discussion? Apologies if this was not clear. The way that all of these cases, including the case that Mr. Pelli nicely summarized here, is that we lead with an individual scenario. And that's certainly the case here. In fact, in this particular module, there are 2 scenarios, one that we start with, and then as Mr. Pelli mentioned, there's a second one at the end to understand, how cardiovascular disease can present differently in different, patients. And moving forward with these webinars, we can try and clearly make that point clearer, so that you all get to hear a little bit about the modules at the start of the presentations. Mr. Pelli, thank you very much. And maybe if there are additional questions, you can let me, Mike, know, and I'll feed them back to Mr. Pelli, or try and answer them. But let's move on now, if that's okay, to the second case. Thanks, Mr. Pelli.
Thanks, Mike.
Yeah. So the next module was led by Clara at University of Zimbabwe. Clara, can we just do a sound check? Are you able to speak? Can we hear you?
I don't know whether they can hear me. I can hear you.
Perfect. Loud and clear, Clara. Thank you so much for joining us from Harare.
Thank you.
So do you want to give us an overview of this module? This is the module 1, new diagnosis of HIV in a woman of childbearing age. And I'll just transition to the first full slide for you and then hand the speaking responsibility over to you, Clara.
Thank you, Mike. The goal of this module is to prepare learners to assess and manage a woman newly diagnosed with HIV using a team-based approach. And, got 6 objectives here that will use that will guide us in the module. The first objective there is to identify barriers to and describe strategies to improve linkage to care. Number 2, to recognize the psychosocial effects of a new HIV diagnosis. 3, list risk factors of HIV transmission. And 4, discuss appropriate ART regimens for any adult. Then describe contraception options for women living with HIV. And the last one, describe the appropriate clinical management and follow-up for A, newly diagnosed patient, and B, a stable patient with undetectable viral load. So we move to the next slide. The strategies that we are using, most of the strategies that we are using for these objectives is the small group discussion and also using small activities, small group activities. The evaluation, for objective number 1, we use a pre and post test. And for objective number 2, we also use the pre and post test. And also, we also use a Likert scale and facilitator in observation. The third objective, the same pre and post test, and also use MCQs. For the fourth objective, is pre and post test, MCQs, and the Likert scale. And then for 5 and 6 also is pre and post MCQs and Likert scales. So if we can have the next slide.
Clara, this is Mike here. Could you just remind us of the vignette in this case? What's the actual scenario and how does it unfold?
Sorry, I missed that, Mike.
Oh, I was wondering if you could just remind us of the case scenario that this module is based around. How does the case unfold over the course of the module? Okay,
we are looking at a young lady of a childbearing age who's actually attending an OI clinic. She's coming in to receive her results, positive results. And she's also coming in for initiation into treatment. She's somebody who's working, and she's sort of decided she does not want to have children at the moment, but she's planning to have children later on.
Great. So maybe just to ask, and I think the first one is really clear, Clara. What are the learning methods that we employ here to teach on this subject?
Okay, for this module, we actually employ small group discussions and activities, and we also use evidence-based medicine, to come up with the best scenarios or best decision that we can use to apply, or application of the scientific methods, to medical practice.
Great. And just remind us, Clara, what is the content that we're trying to communicate here?
Okay, the content for this module includes the following. We have a content on the HIV continuum, so that the learners will actually appreciate the different stages through which a newly diagnosed patient goes through, from the diagnosis up to viral suppression. We also want the student to appreciate and understand the care cascade, and also the move towards the UNAIDS 1990 targets. That is, want to make sure that they understand, we're hoping we're moving towards 90% of the patients that are living with HIV to know their status, and 90% of the HIV patients to be on treatment, with 90% of those patients that are on treatment to have a viral suppression. We also have content that will help the learner to provide information on how to support a patient with a new diagnosis, to help them with counseling, disclosure, at initiation, and different options for women of childbearing age. We also have information on contraception options for women that are on ART, and the different follow-ups, and lab work that needs to be followed for these women.
That's great. Thank you, Clara. And maybe I can just add two additional pieces here which are relevant. One thing that this module addresses is, as Clara said, was what is the appropriate antiretroviral therapy for women of childbearing age. And as many of the experts, HIV experts on the call will know, this has been a real hot button topic of late, given that the data that seems to be coming out of Botswana showing an increased risk of neurological abnormalities in women who were on dolutegravir at the time of conception and gave birth to infants with neural tube defects. An apology here from the UCSF crew. As some of you will know, the guidance from the WHO on this issue recently changed in light of data that was shared at the HIV conference less than a month ago. And we actually did update the module to reflect the fact that WHO now do recommend dolutegravir even in women of childbearing age. But the draft that we shared with you all in Lagos didn't reflect this change. So version 2 will reflect the updated guidance on dolutegravir in women of childbearing age. The other thing that Clara mentioned was the important ECHO trial. Again, some of you may have actually been involved with running that trial that looked at whether or not HIV infection risk was associated with different contraceptive methods. This data is also pretty hot off the press and reflects best practice, reflects best evidence that may not be reflected in all country-specific guidelines, given that guidelines take some time to update. But we would strongly recommend including this element in the modules, even as you adapt to your situation. Clara, before we move to the next question, there is a question from the audience. A situation could guide the discussion. And to clarify, we do base the case around a specific situation. As Clara said, we use the scenario of a young 24-year-old woman who comes in and is HIV test positive, and the case unfolds, describing all of the challenges that Clara mentioned related to her new diagnosis. The next question, Clara, for you is, what are the essential interprofessional education tools or skills that we hope to teach the learner?
Okay. Yes. Interprofessional education actually exists when you've got students from 2 or more disciplines learning together. So one of the things that we are recommending is that, when you're using these modules, you get learners from different professions, from nurses, doctors, physiotherapists, so that they all come together and they learn together. And that actually reflects interprofessional education. Also, the way the care for this newly diagnosed person is going to take place, we are looking at a collaborative effort between the care teams and community in providing the support that the patient will need during this continuum of care. And
That's
also
great.
also the other thing, we're looking at the facilitators, hopefully, with a larger group, when you've got co-facilitators, we actually propose that we have, different, facilitators, co-facilitators from different disciplines, and that actually embodies what interprofessional education is all about.
Thanks, Clara. And I just want to recognize your own personal expertise in this domain at the University of Zimbabwe, leading the interprofessional education effort as part of the HEPI grant. And we're really grateful that you were able to contribute to this module. So thank you. The last question for you, again, it's sort of a trick question. Are there QI methods or domains addressed in this module? This is a module where we don't specifically introduce a new QI methodology, right?
Yes, yeah, we didn't introduce it on this module. Yeah.
And look, I think our hope is that, again, this is a module that fosters, an approach to clinical engagement amongst the learners that is about critically engaging with up-to-date evidence and all of the available patient-level data. That is clearly an important sort of piece of QI, but this is not a case that focuses specifically on QI. Okay, thank you, Clara. I just was going to share these last couple of slides, which are slides that are part of the module. I don't know whether you want to speak to them at all or have anything additional to say on these last couple of slides.
It's okay, Mikey. I will let you speak to them.
Okay. So in every single module, we have a set of additional resources for the trainer to use. So that, as I think many of you will know, there's a facilitator guide, there's a learner's guide, and then several of the modules include a short PowerPoint presentation that help the facilitator to teach certain elements of the case. And so at the point in this case where there is a discussion around 90-90-90 and the importance of the sort of the care continuum, we suggest using this slide if there's a projector and computer available, and it clearly illustrates the global HIV care continuum. As Clara mentioned, one of the activities in module number 1 relates to transmission risk and how different activities confer greater or lesser risk of HIV acquisition. And so this slide, identifies that relative risk per 10,000 exposures associated with different kinds of exposure routes. And again, we imagine that the facilitators or trainers could refer to this as they're reviewing the answers to that particular question as trainees advance through the module. I think there was one extra slide. So the last piece of this case is thinking about how to optimize person-centered approaches to care responsive to the public health constraints in different settings, and we talk about differentiated approaches to HIV service delivery, and this is something that's unpacked in brief at the end of this case. The learners are asked to describe how Naomi could get followed up in terms of where she could access care, and so we introduce this idea of differentiated service delivery. There are actually other modalities for teaching, other modules rather, where we come back to this issue of differentiated service delivery. So the hope is that this case sort of whets their appetite for discussing this, but it doesn't go into too much detail. Clara, anything else you wanted to add on this case before we close out?
No, no, thank you, Mike. I think I'm done.
That's great. Thank you. One last thing to say is that this is one of the modules that we recommend being a compulsory requirement for learners, so that all learners across different situations do learn this content because of its relative importance. You know, not only important to PEPFAR and its agenda, but also more importantly because it covers key domains that are relevant to clinical practice in terms of you know, managing a patient with newly diagnosed HIV and addressing both the psychosocial and the public health challenges related to HIV service delivery. So we're coming up to the end of the hour. If there are questions, happy to entertain them now, either for Msapeli or Clara. So if you do have questions, please add them to the chat box. And while you are thinking of things that you might want to ask, let me just start back where I started. You know, this is draft version 1.0. Our hope is that there will be subsequent iterations of these modules that are responsive to your comments and your recommendations, both in terms of sort of pedagogy as well as content. So if you see areas for improving how we deliver interprofessional education around this case, or you think there are gaps in what learners could learn, then let us know. That's about revisions. Let me also speak to the importance of adaptation. We recognize that some of these modules need to be adapted to your individual country situation. So let us know if there are ways that you would teach this in your setting, whether it's Uganda, Zimbabwe, Botswana, wherever you are, so that we're teaching content that is in line with your guidelines wherever possible. So I see this question again from somebody saying situation could guide the discussion. This is a great comment. As we move forward with these webinars, I'll make sure that we clearly identify the scenario in each case so that it's easy for you, the listener, to understand where these individual modules are leading. So thank you for that comment. All right. Responsive to the fact that you all have busy lives, let's close out here unless there are any additional comments. This webinar, the recording of this webinar will be posted on the AfriHealth website in the very near future. If you have any questions about this, then let us know. If you have revisions or country-specific adaptations, certainly I welcome those. So send them to me, michael.reed2@UCSF, or stridehiv@ucsf.edu. This is the first in a series of 10 webinars where we're going to go through all of the modules in a little bit more detail. So next week, same time, same place, we'll be discussing module 3, which is the management of HIV/TB co-infection, you know, a hugely important topic, and module 4, PMTCT, care of the pregnant mom with HIV. Unless there are further questions from the audience, let me thank our speakers, Clara and Msapeli, not just for speaking now, but for their substantial contribution to developing these modules over the last 3 months, and all of you as you take this resource and run with it in your setting. You are also welcome to join the webinar on Thursday. For those of you that are running programs or about to set up Strike programs in each of your country, there'll be a webinar on how to set up sub-awards and addressing the programmatic details of Strike. And I think most of you should have the meeting invite for that meeting. Question from Lionel before we end, which is, would be useful to get a sense of the content detail as well as for future modules. Lionel, if you send me your email in the chat box, I can send you a roadmap document that describes all of the modules and how they all fit together, and answers it to some extent your question. You know, our hope with all of these modules is that they cover a reasonably broad breadth of HIV domains, but certainly we're not covering everything. I'll send you an email and you can sort of dive into the content that we've shared thus far. And again, if you have additional thoughts on what we're missing, I welcome those. Thank you all for your time. I wish you you know, a good afternoon, and look forward to connecting with many of you in a week's time. So thanks all, and goodbye for now.
Thank you, Mike.